My name is Amanda Rodriguez, and I am the policy coordinator for the National Association of Social Workers New York Chapter. Welcome to the third event of the 2026 policy series, the Coalition Chat Issues Social Workers Should Know About. And the chapter extends our gratitude to our attendees and to all of you here tonight who are here to learn and expand your knowledge and to gain clarity and resources for the work that you do. We appreciate your time and your willingness to engage with us on this vital topic. And please note that this event does not offer CE credits, but we do hope that the content will still provide valuable insights and foster meaningful conversations. We would be nowhere without our partners, and the organizations and coalitions that are here today are supporting vulnerable populations and our work every day. We truly appreciate them taking the time to share resources and action items with social workers. This is the time to take action on these important issues today. To ensure a smooth experience, we kindly ask that everyone remain muted while the presenter or guests are speaking. If you have any questions or comments, please feel free to submit them via the chat, or if the presenter invites you to unmute, you may ask your question then. Please raise your hand in the case of a question. A staff member will be monitoring the chat throughout the event to make sure that any questions are addressed. We ask that all attendees respect the NASW anti-harassment policy, which will be shared with you all shortly in the chat. Our goal tonight is to maintain an accountable and respectful environment for everyone and to provide information and resources to those who are seeking it. Additionally, we will be sending any materials and resources discussed today, as well as any info on upcoming opportunities with the chapter to your email by no later than tomorrow. Thank you all once again for being here tonight, and we look forward to a productive and respectful conversation. And with that, we will pass it to our first presenters of the evening. We have the Right to Remain Silent Coalition, or hashtag R2RS. We have Jose Perez and Cecilia Tuber here tonight. So thank you both for being here and take it away.
Thank you so much, Amanda, for the warm welcome, and thank you so much for having us here today. Sorry, we will get started. Let me just uh, enter the slideshow. We'll do quick introductions. My name is Cecilia Tuber. I am the community organizer at Urban Youth Alliance, also known as Bronx Connect, Staten Island Connect, and Manhattan Connect and Philly Connect. So you can see here, we're really all around New York City. Additionally, we're in Philly and we provide services for at-risk and court-involved youth along with formerly incarcerated people. And I'll pass it over to my colleague, Jose.
Hey everybody, my name is Jose Perez. I'm the program strategist here at the Children's Defense Fund, New York, working alongside so many coalitions to end the institutionalization of young people and protect children better in our city. I use my lived experience in both the child welfare system and the youth justice system, as well as the adult criminal legal system, to advocate for young people today and advocate for all children in the country in the world.
Yeah. So thank you so much, Jose. Yeah, so we are two of the two members of the steering committee for Right to Remain Silent, but we're made up of over 150 organizations across New York State. So without taking up too much time, we will get to it. All right. So Right to Remain Silent, also known as, or more formally known as the Youth Interrogation Bill. This is a bill that would require that anybody under the age of 18 in New York State would receive non-waivable legal consultation prior to a police interrogation, specifically a custodial police interrogation. So anything that would be obtained in violation of this rule would actually be inadmissible in court, be unable to use as evidence against that young person.
Yeah,
So
so
the
we assume kids are protected and this is the core problem, right? So in reality, they are one of the most vulnerable groups in the legal system. Adolescence is a critical period of brain and identity development, where decision making, impulse control, and emotional regulation are still maturing, right? And this isn't hypothetical. This is a system. This is a systemic, measurable harm happening every day. You see that the data is there. What's happening right now is 90% of youth waive Miranda rights, and youth are three times more likely to falsely confess, as we know about the exonerated five. And Black and Latinx youth are disproportionately impacted.
Yeah, thank you. And I think that an issue that we really talk about, and you'll see among a lot of youth justice bills and pushing this kind of this agenda forward and really an increase in bills around this is the, as you know, Jose mentioned, the prefrontal cortex development, adolescent brain development. And this is really in, focused on decision-making skills. And we are seeing how young people constantly make decisions based on immediate needs, immediate gratification, rather than longevity and what's going to happen in the future, unlike parents and
Right.
adults.
Right. So why this happens, right? Like this is not about bad decision, it's about developmental reality, right? Children don't understand their rights and more likely to comply with authority, less likely to understand long-term consequences. And all of this is legal right now in New York State. Children are often don't fully understand their rights, right? Children can be questioned. The current law in New York, like what police can do, like children can be questioned without a parent present. They can be misled into waiving their rights. They can be denied clear explanations and pressured through continued interrogation without reminders that they can stop.
Yeah, and so to kind of continue, so what we're seeing, as Jose briefly touched on, is the Exonerate 5 is one of the most egregious cases, not only in New York State and New York City, but also across the nation. This gained, it was a monumental case, gained national recognition because of the coercive tactics and the nature of how those interrogations went about, and also we really noticed how parental support and parental consultation was not enough and is not enough. There was one specific member of the Exonerate Five, Antron McCrae, who actually was being coerced into giving up a false confession and pleading guilty due to his father's pressure. And so we're seeing here that a lot of times parents are not, don't fully understand the Miranda rights, fully understand constitutional rights. And sometimes in these situations, the parent is actually the complainant. And so we see a lot of issues here. And we want to ensure that the children and the parents also maintain that strong relationship and this does not impact it. Um, and yeah, so and again, as Jose mentioned, Black and, people in Spanish speaking communities are the ones who are being impacted the most, along with people who are living in poorer communities. Because oftentimes the affluent communities, they have the means and they have the wherewithal to then hire an attorney, and they know to do so, unlike a lot of these other communities. And so we're seeing this disproportionate police contact, and there is over surveillance in these communities, but also we are seeing a lot of young people, young Black men and young men in Spanish speaking communities who are being incarcerated and who are being negatively impacted by this police interaction and interrogation more than other demographics.
Right. Right. So our core message, and this is what we're demanding, children deserve to understand their rights before they are asked to give them up. And this is the heart of the campaign. Albany does have the power to fix this, and we'll drop a link later on or in the chat or perhaps, during the course of this presentation. And our call to action is to pass this bill to protect children, prevent injustice, and act now.
Exactly. And thank you, Jose. And just to give everyone also a little context of where this is right now. So last session in 2025, the bill passed through the Assembly, which was amazing. That was the second time previously in 2022. And then it right now in the Senate, it passed through Children and Families, and it's currently in Codes Committee. After this, it'll be referred to Finance and then the floor for a vote. So we're really close and we're really trying to push. And yes, we will put a take action link shortly. So the second, the second bill that we're here to briefly speak about is a more recent one. So that is the Youth Justice Innovation Fund. So what this would do is it's a proposed $50 million to fund community-based supports, community-based organizations that are really supporting and rehabilitating young people in these communities, who are oftentimes being impacted the hardest by incarceration, police over surveillance, and we found, that incarcerating young people does nothing but leads them to trauma or re-traumatization. It ends up in a cycle. They continue to go back, and the recidivism rates are extremely high. What we found is that community-based organizations provide those services that actually reduce recidivism rates, additionally save taxpayers money. It's a win-win here. And so this kind of came out of Raise the Age, and Raise the Age was passed back in 2017, and it made, it passed, it bumped up the age of adult criminalization from 16 and 17 to now 18. And so with that, we it was a wonderful feat, but a lot of the funds that were there, one, have not been distributed, but also were excluded for community-based organizations and programs in the city and other regions, which is extremely problematic. And we know that these are communities that really need that money and these programming. So this 50 million would be inclusive to that, and it would be specific to community-based organizations.
Yeah. So, since the passage of Raise the Age, New York has seen meaningful progress. Youth crime has been declining, and evidence pointing to stronger outcomes for young people and improved community safety across the state. But progress has outpaced investment, right? Investment has failed to keep pace with this progress, creating a significant gap between promise and practice. So, evidence shows that between 2019 and 2023, only about a third of allocated youth justice funds were actually spent, and less than 20%, often closer to 10%, went to community-based services that are proven to work. So, as a result, New York City and other high-need communities have not equitably shared in the benefits of these resources, limiting the full impact of reform. So, we are calling for this thing to get passed.
Yeah. And so why it works. So we have seen, as I spoke about, we've seen this evidence-based crime prevention. This community-based intervention and these programs have been a lot more successful in reducing recidivism rate. And again, saving taxpayers money. We see, so to incarcerate one person annually in the state of New York, it's about $120,000. By supporting and funding programs such as ATIs, alternative to incarceration, and reentry programs, we see that that is only 10 to 25% or 10 to $25,000 annually. So we see how that's a fraction of this cost, and it is significantly more successful than incarcerating people. And so this also includes different types of services. So credible messenger, which has been a tool and a method that has really blown up. It started in Chicago, and we've seen how successful it is in actually reaching people who need it the most and who are less likely to listen to others and take a certain path. And so listening to people who've gone through the same experience has been super successful, especially in the cure violence model. Family-based therapies. So, functional family therapy has really blown up in New York City, which has been amazing. And we see how the entire family is served and not just the individual, because it starts, the family dynamics is really important and can actually lead young people to, incarceration, to behaviors that lead them that way, and truancy. And so, these are really important to really service the entire family as well. We see how, so one of the pilot programs, so New York City Arches Transformative Mentor Youth, so they also have AIM programs, and that was 50% less likely to become convicted of a new felony. And we're seeing also among a lot of ATI programs that it's less than 90% recidivism rate when they successfully graduate from the program. So again, extremely successful from keeping young people out of jail, and it really saves people money, and it saves the city and the state money. So yeah, it improves safety, reduces incarceration, and saves taxpayers dollars. So it's a win all around. Jose.
Yeah, so we would like we would like you all to stay involved. We would like for you to just continue and supporting these very important bills, these very important movements. The Youth Justice Innovation Fund has an opportunity to get passed this year in the budget, so we're hoping that gets passed. Stay involved. Contact me, Jose Perez. My email is right here. You can contact Cecilia at Bronx Connect. We are both working hard to get this bill passed. And then also you can sign up if you see the Google Form link to sign up to stay involved, to keep yourself posted on all the things that we're doing. And really appreciate everyone for listening today.
Yeah, thank you so much. And I just want to also quickly, mention that I know that so the National Association of Social Workers is signed on. We're really excited about that. But if you are involved in any other groups and any other, organizations that you think may be interested, that signing up, and staying involved is really, that would be amazing. And again, reach out to Jose or myself if you have any questions, if you want to learn more, we'd be happy to speak about that because we want to, be mindful of time. But thank you so much for allowing us and giving this space to talk about these important bills.
Thanks.
Thank you so much to Right to Remain Silent for being here today to present about a very important issue. And I did drop the act now in the chat, drop a fire emoji. If you do send a message to your legislators about this important issue. Going on to our next presenter, we have here Christine Roulette, a retired clinical social worker and on the board of the Physicians for a National Health Program, or PNHP Metro. Christine, take it away. You got to unmute yourself first.
A minor correction, I'm on the advisory board of I'm a retired clinical social worker, and I'm here also with the executive director of our organization, the Physicians for National Health Program. By the way, I'm also a longtime member of NASW, and I was active in the New York City chapter with the issue I'm going to present. So just as a little note, did you know that 32 of the richest democracies, developed countries, have universal health care? We, as part of the group of 33, are the only one who do not have universal health care. And you hear my accent. I'm from France originally. I'm a proud American, but I'm not proud of that particular policy because everybody asks me, but Christine, why is it the US, the richest country in the world, doesn't have universal health care? That's a whole story, the answer. But this is where we are. So next. So I just told you I used to work at Montefiore Medical Center as I was a clinical social worker for the HIV/AIDS clinic, but I also became involved with the the New York City chapter with the issue of healthcare, and particularly the New York healthcare. Next. Let's look at the New York Health Act. I don't know how many of you are familiar with it, so forgive me, I'm going to go very quickly and very simply on it, but just to make sure everybody knows what it is. The New York Health Act is a comprehensive plan that would provide coverage for everyone. So it doesn't matter, and everyone, we mean every resident, not citizen, every resident of New York State. That's very important. Remember that. It doesn't matter what your immigration status, your income, your wealth, your employment, and so forth. And it also an important thing is, as you see, it eliminates the barriers to care because everybody know. I think especially social workers know how often people will not go to a doctor, will delay going to a doctor because of money problems, because it is so expensive here. So there will be a premium in the New York Health Act, but there will be no copays, no deductibles, no coinsurance, no out-of-network charges. And I will add, there will be no gatekeepers You know, the people who tell you in the insurance company when your doctor said you should have this procedure, and the company tells, sorry, it's not covered by your insurance policy. I mean, these are gatekeepers that prevent patients from having the care that they need and they deserve. And all this would be providing the comprehensive set of services, mental health, dental and vision, long-term care. The previous versions of the Healthcare Act didn't have long-term, but it was fought over and it was agreed that it should be included. Prescription, reproductive care, and preventive care. Next. So we would spend less for care. Now you see the amount of money that people have to spend, and what is not said is the millions of New York State who are uninsured or underinsured. Underinsured mean their insurance doesn't cover enough, and they have to pay so much. So this would be the advantage of the New York healthcare. Let's move on to the next one. Next, thank you. So how can we afford it? That's a question that everybody asks. When you look at the savings of this system, by the way, there were two studies that were done. The latest is the RAND Corporation, which is usually not considered a very progressive company, but they studied it and they admitted that there would be savings, and particularly when you reduce the insurance cost, when you reduce the administrative cost, and you reduce the price of drugs and devices. So you have this total, which is there, 58%. It would cost more in the sense that you would have to cover everyone, and you would improve the fee for providers, and you would have also higher costs in terms of the long-term care. But when you go from the savings to the higher cost, you get a net saving of 16.8. Thank you. Next slide. Yeah, actually, Morgan, I think we skipped one, or maybe I asked you to skip too far. The first one, which is the single payer, the one after that's it. I just want to explain because this is so important. This is a single payer because people are very confused about what single payer means. Single payer is what is on the top of that slide. You see that people and businesses are sending their premiums or their tax, if you want to call it like that, to one government entity. And it would go into New York, in the state of New York, it would go to a special fund, a healthcare fund. And then we as a patient would have our little card, and when we go and see a doctor or a hospital or any provider, we present a card. And it's that provider, that doctor, that hospital that would then request funding, reimbursement from the fund, the central fund that where it received all the premiums and all the funds. So is that clear? So why is it called single payer? Because there's only one entity that pays back the doctors, the offices, the hospitals that provide services to patient. That's what a single payer. It's so simple, right? One little detail that is not covered in this thing, and which we will see in another chart, is that there's also government fund from federal government, like Medicare or Medicaid, that would be added either directly into the fund. Thank you. There you go. In that chart, you see that on the chart on the right, you see that there's not just the New York health tax, which I've just described, that employers or individuals pay, but there's also the federal government, because Medicaid is a fund, right? So it would go into it would be pooled with the fund. Anyway, I don't go. So let's stay on this chart. Why is it affordable? Because it's a progressively graduated tax on income. And by the way, income, it's not just the salary that you get, but it's also the dividend and the capital gains. So taking all that into account, 95% of the residents would pay less. I know it's hard to believe, but believe me, it has been studied, and it is true that 95% of people would pay less. And the first 25,000 of your income is exempt. If you're on Medicare, the first 50,000 would be exempt from taxation or from premium. We can call it tax or premium. It's whichever you prefer, but that's what it is. And by the way, for the payroll income, the employer would take at least 80%. In some cases, as you know, for instance, some city agencies, the employees have managed to obtain 100% of the employer paying the premium tax. So it would be at least 80%. That's what it says. Next. Okay. Now, how is that possible? We saw that one of the big savings would be in administrative overcost, but look at that. Medicare requires only 2% for overhead. Look at all the main or some of the big insurance company. Now, you will say, where does all that money go from this insurance company? Well, the huge benefits that are given to the executives, and particularly the head executive, but also the advertising, also profits that are for shareholders and so forth. So there's a lot of money that is saved, and this is a perfect illustration of where a huge chunk of the savings would come. Next. Now, here's an example. Here's Duke in the US and Toronto in Canada. In Canada, as you know, they now have a national universal health care. They didn't used to have it, by the way. They started with Saskatchewan in, I think, 69 or something like that. And it was eventually everybody around Saskatchewan, the province, said, oh, I want to have what she's having, you know, what they're having. So the government decided to give it to everybody. And so since 72, they have universal health care. But look how simple it is. They need only 7 billing clerks for 1,200 beds, whereas in Duke, they have, I mean, this is no joke, 1,600 billing clerks. Why? Because they've got hundreds of different plans, plus they do upcoding because they want to get better reimbursement from these insurance company. So look at the difference. It's hardly believable. Next. So we want, oh, by the way, I wanted to ask you, some people say, well, we don't want socialized medicine. Now, do we say that Medicare is socialized medicine or Medicaid? And yet they are single payer, right? You pay into Medicare and Medicare reimburses all the providers. And that is not socialized medicine. The private care would not change with the New York Health Act. So where do we stand? I know we don't have much time, so I want to give time for comments after. It's now in the Assembly. It's been introduced by the chair of the Health Committee, Amy Poland, and it has 76 co-sponsor, a lot more than I thought before. That is an amazing number. And when it's been introduced in the Senate, there are 34 co-sponsors, and this is 63 senators in total. So you see that there is a majority of our elected officials in New York State who believe that the New York Health Act is an important act, and we will put in the chat the numbers, what it is. It's A 1466 and S 3425. And obviously what is important is that eventually it goes through various committees. after the healthcare committee, and then put to a vote by the leaders of the assembly. So next. We need to take action. And how can we take action? Well, one is obviously contact your state senator or assembly member and this is, Morgan has kindly added this way to access easily who's your senator, who's your assembly member. It's important. And by the way, we spoke to staff of these senators and assembly. They all say phone calls are very important. They do keep track. They do count every single phone call in favor or against bills. So it is not a waste of our time to call them. Share your healthcare story with particularly with the PNHP Metro. And this is a link to share it, because there's nothing to convince our senators and our assembly members, nothing like these heartbreaking healthcare stories we've all heard. And social workers are in the front line for hearing heartbreaking stories about people who, because of our healthcare system, are not being cared for, are dying even because of lack of healthcare. And organize a meeting at work. I've done that in my own work at Montefiore to talk with coworkers about the New York Health Act, and we can help the Metro chapter of Physicians for National Health Program is very good at that. That's their focus, is getting that passed. So, by the way, the Physician for National Health Program welcomes all providers, whether they're social workers or nurses, not just physicians. Okay, thank you. So you can click on that, and I will turn it over to also Morgan to add anything that she would like to add in terms of actions and so forth. Please feel free.
Thanks, Christine. I'll
Thank
hold
you
for
so much.
questions later, but happy to answer any questions folks have, and I'll drop the links into the chat in a second.
Okay, I hope I didn't
Thank you so much. Thank you so much. That was an amazing action item for social workers. Drop a fire emoji in the chat if you do complete the wake up call for the New York Health Act action alert in the chat. I did drop that in there. And if there is space for questions at the end of the event, please hold on to your questions and you can ask them then. We are going to go to our next presenter. We have here Social Workers for Justice. They are part of the campaign to call on the ASWB exam for necessary reforms and to eliminate the requirement for the ASWB exam in New York State as they look at the biases that are persisting in that examination and creating barriers for social workers to enter the field. So welcome, Maria. Feel free to take it away.
Thank you, Amanda. Hi, everybody. I'm going to share my screen. Can everybody hear me?
Yes.
Okay. Okay, great. Hi again. I'm Maria. I am a social worker. I'm based in the Bronx. I work with homebound older adults, providing services and support to them. And I'm a member of Social Workers for Justice, and I'm happy to be here to talk about our cornerstone campaign. But I want to talk about the mission of Social Workers for Justice first. So we're a movement that aims to build the power of social workers in New York State, and we use this power to strengthen the social workforce and in turn strengthen the communities that we serve. And part of that is restructuring the way that social workers in the state earn their LMSW. So we are campaigning for the passage of the Social Workforce Act, and I've provided the bill numbers in both the Assembly and the Senate. And the Social Workforce Act aims to eliminate the ASWB exam requirement for the LMSW licensure in New York State. Future social workers will obtain the LMSW licensure by meeting all the other requirements. And by that, I mean candidates would still be required to graduate from accredited MSW programs with rigorous academic and fieldwork components. These programs equip graduates with the skills and knowledge to serve effectively as social workers. And the purpose of the Social Work Workforce Act is to address the immediate mental health workforce, to address the mental health workforce crisis in New York. And to talk a little bit more about that, the Mayor's Commission on Community Mental Health finds that 30 to 45%, there's a 30 to 45% vacancy rate in client-facing jobs of New York's non-for-profit organizations. And social workers are a big part of those client-facing jobs. I mean, I don't know about, I'm currently in the situation now, but how many of you have currently or have had been in agencies that have been either fully staffed or had a manageable caseload? You know, most of us, I wish most of us can say that, but a lot of us can't, right? And 80 also the research shows that 80% of the clients are from high need communities that are really suffering from this workforce crisis. And by high need, I mean clients that are facing injustices, racial and gender injustices, the immigration related injustices, disability and aging related injustices. And they need social workers that look like them, speak their language, and understand their lived experience. And so a question that I want to ask is, does your staff reflect the populations you serve? Right? This is why we need the Social Work Workforce Act. So the ASWB exam is the barrier that solves this crisis. And the licensing exam disproportionately impacts social work candidates of color. Data that was released in from 2011 to 2022 shows that in New York State, 88% of white graduates passed the LMSW exam on the first attempt, as compared to only 49% of Black graduates and 62% of Latinx graduates passed the LMSW exam on the first attempt. And then we also have recent analysis from the 2024 ASWB pass rates. And this creates a crisis. And the agency that I work for is experiencing the crisis that I'm about to explain because of a shortage of social workers that speak the same language, that are of the same culture, that have the same lived experience as the clients. What ends up happening is that agencies compensate. They end up, because to address the immediate need, they hire workers that don't have that same training as social workers do. And so you lose that quality assurance that is really important in solving the issues that clients that approach you with. So a few more facts. There is no evidence that test results correlate with the effectiveness of the social worker. I'll give myself as an example. Along with using my training as a social worker, the most impact that I make on my older adults and their family caregivers was my lived experience as a family caregiver. As soon as they hear that families hear that I took care of my grandparents from a very young age, they open up and I'm able to solve all of the problems that families come to me with and whatever they're facing. The only variables that correlate with passing the exam, as we have seen, are race, language, and age. So based on the data, we have young white English-speaking social workers that are disproportionately passing the exam. ASWB does not follow the standards for educational and psychometric testing in either developing or reporting its exam. And that's important. That's a requirement across all professional exams that they follow those educational and psychometric testing. And they refuse to prove that the exam is fair across groups of test takers. It's been ASWB has resisted releasing any recent data on its pass rates across the groups of test takers. And so while they're refusing to release this data, they're making millions of dollars and disproportionately keeping the social workers that we need to help the communities that we serve. It's important to know that licensure disparities in social work are 3 times greater than in other professions like education and nursing. Specifically, we have 30% disparities in social work as compared to 10 to 12% in education and nursing. This is also important. 7 states and Washington, D.C. have already done away with the exam. 10 states never had an entry-level exam, and 8 states are in the process of working to eliminate it. And Maryland and Virginia have their own pieces of legislation in their states now. Social workers who do not pass the exam make $20,000 less. I'm in my field of work because I feel that my lived experience addresses needs that older adults and family caregivers need to have addressed. I'm also having to take a pay cut. So it shouldn't be that social workers have to choose between engaging in fields that they feel called to and that they feel passionate about and not be able to address their own needs. Because if social workers can't address their needs, how are they able to address their clients' needs, especially clients that they feel called to serve? So what we do at Social Workers for Justice is that we have licensing committee meetings every other Mondays at 6:30 p.m. It's receiving updates on the Social Work Workforce Act passage, and we invite you all to join, share your story. Do you have a story about your test taking experience? Gaining support from elected officials, organizations, and social work schools. As of now, we have 12 state senators, 43 state assembly members. New York City Council last year passed a resolution to support the passage of the Social Work Workforce Act, and Mayor Mamdani is also in support of passing the Social Work Workforce Act. So we have already a big support. We're looking for more, and we're working on doing that. And we invite you to join us. We also work hard to advocate on across all forums. This past January, we've gone to this state capitol in Albany to meet with legislators to ask them to pass the Social Work Workforce Act. We also do local level advocacy events. We have a power school where if you're new to the advocacy field and you want to know that on how to meet with legislators and how power is built amongst social workers, this is your opportunity to do it. We're very glad to host power school sessions. Building our base, we're always out meeting new social workers. I'm always out meeting new social workers, asking for their experience and asking them to join us. We also do advocate in New York City City Hall. And we had our first founding convention last September, and we're looking forward to doing more and inviting more social workers into our movement. Our immediate ask right now is for you all to, and Amanda, I think will drop a link into the chat to ask to contact the State Department of Education and contact ASWB and tell them to release the data now. We need that data. We need that piece of information to know how many social workers, especially social workers of color, are passing the exam, right? We need to know who is being kept from the qualified people that are able to serve the communities. all of our communities in this area. And we also ask that you join us. It's $10 a month, um, and that's the QR code to scan. And thank you.
Thank you so much, Maria, for presenting about that as we advocate for a more fair and equitable licensing process. Next, we have an important presenter here from the Raise Children Coalition. This act is aiming to protect all New York families by creating and codifying a clear, more streamlined path to parental recognition. Welcome, Raise Children, and feel free to begin your presentation as well.
Thank you. And thank you, Amanda, for having us and having this event. Everything that's been discussed so far sounds so important, and it's great to listen in on. I'm Sadie Arlen. I'm here with my colleagues Spencer Barish and Susan Hazeldine from the LGBTQ Advocacy Clinic at Brooklyn Law School. This clinic is a clinic just at Brooklyn Law School that provides free legal services to low-income LGBTQ New Yorkers and advocates for the LGBTQ community and for equality. We're working with Family Equality and other members of the Raise Children Coalition, including the New York chapter of the National Association of Social Workers. So to explain more about Raise Children and family equality, we have Danny King.
Hi, everyone. So thank you so much for having us. And I'm glad that we're, in this space, collaborating together and talking about intersectional issues. So my name is Danielle Danny King. I'm a family law attorney based in New York. I'm from New York City, but I'm in the Hudson Valley. I've practiced in Queens, Manhattan, Brooklyn Family Courts, and now currently in Dutchess Family Court. At Family Equality, the main focus, and I'm a current consultant as well with Family Equality, the main focus is on LGBTQ families, and that's parents' advocacy work and children's advocacy work to ensure that LGBTQ plus families are able to thrive and are, supported. And I know, especially, during these times, things are, pretty difficult. And so, we just, want to make sure that families, regardless of how, they identify, whether it's the parents or children, feel that they are supported. Raise Children's Coalition members. So, Sadie went into letting you all know about Brooklyn Law School, who is our coalition partner. So Brooklyn Law School and Family Equality are heading up the advocacy work on raised children. Besides NASW, we have a growing coalition, and we encourage anyone who's on the call now to join, which includes Collage, Glad Law, Better Balance, NILAG, Equality New York, New Pride Agenda, U.S. Donor Conceived Council, Organization for Polyamory and Non-Monogamy, and several law school outlaw groups, including Brooklyn Law, CUNY Law, and NYU Law. And so Sadie, Spencer, and I are going to go in a little bit more detail on the bill, but I'll just give you a few, big picture lenses of what the bill entails. So it's going to update the parentage laws in New York State in four key areas. And I know we have a slide next, I believe, that has that highlighted. So the first process is a streamlined confirmatory adoption process for families who use assisted reproductive technology. And especially what we've seen in our recent legislative meetings is that, more and more folks are using assisted reproductive means to have children. And so, especially given that a lot of folks are having children, later in life, more folks are using assisted reproductive means. And so I think the understanding is there that might not have been there in years past. And so the confirmatory adoption process makes sure that the non-biological parent, but who is the intended parent that would have planned, been in, them and their partner's, life to plan to have a child are not treated any differently by the court system. And so, unfortunately, the way the courts are currently set up, you could have a partner and you could decide to use assisted reproductive means. One can be the genetic relation to the child and the other not, but you're planning to raise a child together, do all the planning, go through, the assisted reproductive means, and then be treated very differently by the courts. And so the non-genetic parent, generally, there's other routes where they can try to get acknowledgement of parentage, but that isn't always necessarily accepted in every state. So most folks decide to do a confirmatory adoption, which means that they go through, sorry, most folks decide to do an adoption. We're asking for confirmatory, but most folks decide to do adoption so that they can have full faith and credit, meaning whatever state they go to that they're allowed to adopt. And so through the current process, it's lengthy home studies, et cetera. And I know we'll go a little bit more in detail about some of those means, so I don't want to go too much. But, we're trying to make sure that families that are planning to have a child don't have additional barriers that weren't really designated for them, right? They were more designated for strangers who were adopting a child that they, may not have known a year or two before. And now the courts want to make sure that it's a safe placement and check their home. It wasn't really designed for parents who have been planning, before the child was even conceived to have them to go through these kind of barriers. And so the other provision is multi-parent adoption petitions. And so, as time is going on, folks are having blended families, a lot of different family networks that don't look like, what they may have, 10, 20 years ago. And that's okay. We want to make sure that if there are folks who, want to make sure that they're able to have multiple parents, do the adoption mean that we actually are allowing courts to acknowledge that more than two parents can adopt. Also, the bill has provisions that has listed the mechanisms that the courts have to actually grant those petitions. So, currently under the law, there's been a split between courts about whether or not you currently can have more than two parents. And so this bill will make sure that that's pretty much clear. And then also establishing a criteria for presumptions of parentage. And so I'll leave that there. I know we're a little bit more strapped for time now, but I just want to let Sadie and Spencer get to go into the other provisions in a little bit more detail.
Okay. Well, I will say that when we're talking about family, we're usually thinking about, not having anyone left behind. And that's just not what's happening right now under current New York law. Like, for example, take Allison and Rebecca. This is a real case I'm describing. A married lesbian couple living in Brooklyn. They had a baby using an anonymous sperm donor and wanted a second parent adoption to protect the child's relationship with Rebecca, who was not the genetic parent. They filed an adoption petition in 2019, but didn't have the money to pay for the $1,500 fee of a private social worker. So instead, they had to have someone come from the Department of Probation to do this adoption. But the Department of Probation stopped doing home studies during the pandemic, and for 3 years, they still hadn't restarted. So Allison and Rebecca were not able to complete their adoption. And eventually, the family had to move states to Tennessee and had no choice but to wait and get an adoption in Tennessee because they just couldn't complete the process in New York. That's not how it should be. Under raised children, Allison and Rebecca's child would have been protected by a confirmatory adoption process that doesn't require costly and intrusive background checks and home studies for people who conceived using assisted reproduction and are already legal parents. 12 states, including California, Colorado, Illinois, Maine, Maryland, Nevada, New Hampshire, New Jersey, New Mexico. So it feels like I'm singing the state song. Rhode Island, Vermont, Washington, they've already created this streamlined confirmatory adoption process. But this bill would also make it clear that a child can have more than two legal parents in New York, which is not just an issue affecting LGBTQ families. Like when a child with parents that are getting divorced and remarries, sometimes a step parent can become a functional parent. Sometimes that step parent can become your closest parent. And raised children would allow that third parent to legally become recognized as a parent without either of the original parents having to give up their rights. The bill also updates presumptions of parentage, ensuring that married parents who have a child together will be recognized as legal parents of the child, and that presumptions of parentage don't have to depend on marriage. This is important in cases of protections for LGBTQ families, especially in this time when these protections could be rolled back. And I feel like we're all feeling some anxiety about that. So now I'm going to toss it to Spencer to talk about the language this bill updates.
Yeah. Hi, everyone. Don't worry. We're going to be quick. The bill updates some antiquated language that's currently in New York domestic relations law, such as terms legitimate and illegitimate, which to me is just kind of crazy that that still exists in domestic relations law. The bill also updates gendered terms such as he or her to reflect a more modern landscape of what our society currently is. Additionally, the bill um, the bill allows for more judicial efficiency. It promotes judicial efficiency by expanding the presumptions of parentage to include multi parent families and households. The court can safeguard children's security and prevent these really long and expensive legal proceedings. We really hope these conversations highlight why Raise Children Bill is so important for families across New York. If there is something that resonates with you, we encourage you to support the bill and advocate for it in your everyday life, whether it means talking about it with friends, sharing it within your networks, or helping raise awareness about the need for more inclusive parentage laws. And if you're interested in getting more involved, we would love for you to join us in Albany on May 7th when we are meeting with legislators to ask them to support the bill. And if you know any individuals, families, or communities who have been affected by gaps in parentage laws, we would really appreciate being connected. These stories are incredibly powerful in driving change. Thank you guys so much for being here and engaging with these issues with us. And we really hope you have a great day. Thank you so much.
Thank you so much, Raise Children Coalition, and be sure to get involved if you know anyone who is going through a similar instance, or if you just want to support the LGBTQI community, like I'm sure everyone in the room does. So, moving on to our next presenter, we have here tonight the New York Immigrant Coalition. We have Cassandra Bocanagra, Senior Manager of Organizing and Strategy from the Finger Lakes region. Welcome, Cassandra, and thank you so much for being here tonight.
Hi everyone, good evening. Um, I'm going to share my screen. Please let me know if you see it.
We can see.
Awesome. Hi everyone, my name is Cassandra Bocanegra. I use she, they, ella pronouns. I am the Senior Manager of Organizing and Strategy for the Finger Lakes region with the New York Immigration Coalition. The New York Immigration Coalition is a member-based organization with over 200 members across New York State that encompass both religious, healthcare, educational, nonprofit, direct service organizations that are all advocating for immigrant rights in some way. It might not be their primary focus, but it is part of their focus in terms of supporting the community. Our members are organizations. We're what's called a grass tops organization. Our members are made up of organizations that are doing a lot of that direct service, and we support our organizations and community by providing some of that legwork in terms of having information and deciphering some of the stuff that comes out of both local, state, and federal policy as we're moving forward. I'm going to talk about the New York for All Act in particular. Apart from being the Senior Manager of Organizing and Strategy for my region, I'm also the lead on the New York Immigration Coalition for New York for All. New York for All has been a piece of legislation that we've been working on since 2019 to end collusion between local and state agencies and federal immigration agencies. So just a little bit about who is leading on the New York for All campaign. We are made up of a steering committee of 8 organizations, including the Immigrant Defense Project, the New York Civil Liberties Union, Vera Institute of Justice, the Columbia County Sanctuary Movement, Bronx Defenders, Make the Road New York, and Alianza Agricola, as well as New York Immigration Coalition. And then our coalition is also made up of over 140 organizations that are supportive of New York for All. So the problem that we are looking to resolve is that local law enforcement, probation officers, and other state and local agencies routinely conspire with immigration, ICE, and Customs and Border Patrol. This has led to mass arrest, detention, and deportation of many immigrant community members. So New York for All would prohibit the state and local officers from enforcing immigration laws by prohibiting the asking of immigration status unless required by law or necessary for public benefit, prohibiting the notifying of ICE about a release, about a transfer, entering immigration status into database, or sharing sensitive information with immigration officials. I'm going to go through this one a little quickly because I actually have a better slide that shows the different things that New York for All does that I'd actually would like to ask everyone to screenshot if you can. So this is the one that I was talking about. So I think it's sometimes a little difficult to understand fully what New York for All does, but it does do more than just end collusion by ending 287G agreements, which is what if folks have been keeping up with the governor, she introduced something earlier this year called Local Cops, Local Crimes that looked to end 287G agreements, which were the formal agreements between local and state agencies and federal immigration agencies as part of that bill, and it did have a 3-year like time limit. So New York for All would address that 287G agreement of making sure that any existing 287G agreements are null and void, and any future ones are not able to be brought in. But I think the biggest thing that we're also seeing is the usage of CBP as interpreters, especially in different agencies. I've traveled up to the North Country to do some outreach, and I've gone to like the DMV to see like, hey, just out of curiosity, do you guys have like Spanish driving manuals or French driving manuals, so that folks can come in here? Like, what do you do if somebody doesn't speak English? And I've been told that, oh, they'll just call immigration to serve as interpreters. And so we know that when immigration is brought in to serve as interpreters, oftentimes people are detained or separated from their family and then end up in deportation proceedings. So I encourage everyone to take a screenshot of this to make sure that you have the information about what New York for All does handy and easy to access. Um, So just to say all of that, that New York is behind. The New York, New Jersey, or New Jersey, Washington, California, as well as Illinois, and many other states already have some sort of anti-collusion bill. Um, and we also know that the Major Cities Chiefs Association, the Presidential Task Force on 21st Century Policing, as well as other organizations, have also adopted policies and positions that keep federal immigration agencies and enforcement on the ground out of that keep those separate to ensure that our communities are not harmed. We also know that in localities where New York for All type bills are in place, we've seen that on average, the median household income is higher, the poverty rate is lower, the unemployment rate is also lower on average. But also the things that are not seen is the sense of peace and relief that it gives to children who are children of immigrants or from part of mixed status families. We do have a situation where in New York City, when folks were coming here with the through the asylum process, a mother's children were taken away from her, and immigration enforcement agencies were called during that investigation. And so she was deported. Her children were also deported, and they were from Venezuela. So that was something that like she went looking for help, and instead of receiving mental health services that she was looking for her and for her children, she received detention and deportation. So our bill sponsors are Assemblymember Reyes on the Assembly side and Senator Gernardis on the Senate side. Assemblymember Reyes has been our sponsor since 2019, and Assemblymember Reyes, Gernardis, or Senator Gernardis has been our sponsor for the last few years. Previous to him, it was Senator Salazar. As of This is actually outdated. As of this morning, we are actually at 76 co-sponsors and 76 co-sponsors on the Assembly side and 35 co-sponsors on the Senate side. Those numbers are actually higher if we count the folks that have said that they would vote yes but have not yet brought it, but have not signed on as co-sponsors. So I think in total, between the folks that have signed on as co-sponsors and the ones that are willing to vote yes, on the Assembly side, we're actually at 82, and on the Senate side, we're at 38. So that is more than half. We do have a significant amount of support on both sides, on both in both chambers. So we also, as we're moving through things, folks, and so, some of this is changing a little bit from what we talked about earlier, given or what I was planning to talk about earlier, given the changes, given the announcement from the governor this afternoon. I don't know if folks saw that the governor gave like a quick press conference this afternoon around 12:30, where she mentioned some different things, where she mentioned where she was at in terms of immigration and in terms of negotiations with the other two parts of the party of the legislator, I mean. One of the things that she mentioned was that she is putting her cards on the table in terms of where she's at with New York for All and anti-collusion bills. And she's kind of landing on what's called probable cause, which would be like if there's a suspicion of a crime, then the collusion is allowed, so to say. We know that if that happens, we as advocates and as like folks who have been advocating for New York for All, and I'm sure you guys as well too, we know that if there's probable cause, oftentimes what that does is it's unfairly targeting Black and Brown communities, and we could see people being used and tactics being used to really further harm our community in ways that are not beneficial to anyone. So I put some information in terms of like some talking points and how we want to talk about New York for All when we are talking to different legislators, when we're talking to different advocates, when we're talking to different folks around us. It's really important that we have New York truly for everyone. So we know that everyone, like New Yorkers, all New Yorkers, everyone wants to provide for our families. We want to provide for our community. We want to participate in our community. And we know that the strength in our community comes from our ability to work together and to learn from each other's experiences. But as we're seeing that our leaders are feeling division, we are feeling division in order to keep us apart. We want to make sure that the leaders who have used ICE to demonize and demoralize immigrant New Yorkers and our neighbors are put on notice. We want them to know that like the ICE raids, the tactics, the cruelty that's being used to separate families, that like that's not okay. And we are going to continue to work and continue to fight to make sure that we have a New York that's truly for all with the passage of New York for All as the bill. So we know that like many of the folks who are directly impacted, who are either part of mixed status families or are immigrants themselves, um, have a fear of going out in daily life, have a fear of participating in their children's school, of letting their kids go on different field trips, of attending or looking for different services because they don't know what that would mean for their family. So I did put this up here and I just want to like leave some messaging. We continuously use the word collude because we know that when we use words like collaborate or support, that it gives this false notion of support or of like okayness with what immigration does with our local agencies. So we use words like conspire, collude, do the bidding of, and of course, whenever you're talking about any of any legislation, not just New York for All, any legislation that might have some opposition, or when you're talking to somebody who might be opposed to what you're saying, we always encourage folks to start on the same page. Like I think we can all agree that it takes a lot to start a new life anywhere, especially with your family. I think we can all agree that everyone should be able to take care of their family and protect their health. I don't think that that's like those are controversial things, but from there we can start talking about where we might be a little different of like part of that means like not having to be worried that because you're Black or brown or driving while Black and brown, you might get pulled over and then detained. But yeah, starting off with those positives and those common shared values and then moving on to what the reasoning is and of course using conspire, collude with, do the bidding of, those words that have that negative connotation with them. um Here's a little bit more, just we want to center individuals, their stories, their circumstances. We've heard of testimonies across the stage. We know of like Mr. Santos, who died in 287 G G agreement detention facility in Nassau County. We know of Mr. Narul Shaham, Mr. Narul Amin, who died who was murdered as a result of the collusion that happened in Western New York. We know that at least 15 cases of workers were stopped as a result of collusion are now in Batavia Detention Center. We know that Delmi hit a car in St. Lawrence County, and when she went to go seek help, the neighbor called the police, and the police called immigration on her. And so she spent 6 months away from her children in a Louisiana detention center. So we know that this collusion is happening across the state, and we know that, like, regardless of what they're saying at the federal level or the state level about like making, like, keeping an eye on the safety of our community, we know that 80% of the folks who are in detention don't have a criminal record at all. So it is vital that we have protection for our communities within our state as much as we can. And so, of course, like, our targets continue to be Governor Hochul, the majority leader, and the Speaker of the House on both the Senate and the Assembly. And I'm at the end of my presentation. Happy to, I think there's like a 20-minute Q&A, so I'm happy to like wait for them to answer any questions.
Thank you so much for that. And feel free to drop a fire emoji in the chat if you complete the Act Now alert that I put in the chat to protect immigrant communities in New York. Complete that action alert if you are interested in helping that movement. On to our last but not least presentation. We have here social workers and allies against solitary confinement with Mary Buser and Justina Rosinski, LCSW PhD. Justina, please feel free to begin your presentation. We know you can only join us for a little bit here.
Yes, thank you so much. So my name is Justina Rosinski, and I am a member of Social Workers and Allies Against Solitary Confinement. And we are currently working to get a very important bill passed. And this bill is really personal to me and my journey as a social worker. So that's what I'll be discussing today. Our bill is called End Health Professionals' Complicity in Torture of Detained or Incarcerated Individuals Act. And our sponsor is Senator Julia Salazar and Assemblymember Anna Callis. And the reason why this bill is so important to me and so personal, because I myself worked on Rikers Island in December of 2023 to September 2024. And when I witnessed what was happening there, and I saw how people with mental illness were being treated and how it was going against my code of ethics, there was no one that I can call to report it. And I just couldn't believe how this was possible, because I have been trained as a social worker that I am a mandated reporter. And when I see my clients being abused, it is my responsibility to call and report this. However, social workers and other health professionals in jails or prisons are not mandated reporters. They're not required to make a report. There's no one to call from the outside that would investigate. And therefore, in September of 2024, I had to resign from my job, and I went to the media to expose what was happening on Rikers Island, because I was really conflicted, like I mentioned, with my code of ethics. So this is why it is so important that this bill gets passed, because this bill would provide protections for social workers and other health professionals working in jails and prisons, where they would be able to make a report, and it would be anonymous. The Department of Corrections would not find out that they made the report, and there would be an investigation. And this is really important for social workers, because we are placed in these settings where we are so conflicted by dual loyalty, because we do, we work in these kinds of settings and it's our job, but then we see things that is against our code of ethics. So this bill is so personal to me and so important, because I always say, like, if this bill was in place, like right now, I would still be working on Rikers Island. And I loved working on Rikers Island. I loved working with my patients, but I just couldn't stand there, watch this happen, and be an ethical social worker. So this is why this bill is super important. And now I will give it up for, I'll give it to Mary Buser, who will introduce herself. And she's the co-director of SWASC, and she has an amazing story to tell as well, and is very inspirational. And I'm so proud and happy to be working on this bill with her.
Thank you, Justina. Thank you so much. And thank you for having us here for this presentation. Again, my name is Mary Buser, and as Justina mentioned, I am the co-director of Social Workers and Allies Against Solitary Confinement. I also feel very passionate about this bill because my work on it is personal to me as well. I also worked on Rikers Island, albeit about 20 years ago. Justina and I are kind of bookends here. And the very issues that Justina described were ones that I encountered. Nothing has changed. I worked in the mental health department. I was an assistant chief of mental health actually for 5 years on Rikers. And I was put in the position. I'm going to give you an example of my very first week at Rikers Island. I was in a stairwell and with a bunch of nurses. We were being held there. Just to give you an example of what we were faced with. And through the glass door, the officers had us wait, and we could see an incarcerated individual being marched down the hallway with the white plastic handcuffs and the riot squad around him. And we waited and waited. He walked by, everything's fine. And then marched him into the receiving room. We couldn't see it, but that's where they take people. So a little while later, all of a sudden, the door bangs open. We jump back, and this same man is now bloodied, moaning, unable to stand up, being supported on both sides by the riot squad, his sneakers bouncing off the steps as they take him up to the clinic. So I was horrified. They'd obviously just beaten him. And so as soon as they were out of sight, I raced back up the stairs and went to my supervisors. What do we do? What do we do? What I just, we just witnessed. And I just imagined them picking up the phone for who we called, but instead they told me to pull up a chair. And that's where I learned that we are, quote, guests in their house. And as guests, we can't make too much noise. I felt so disappointed in my profession. We all go into social work to make a difference. We believe in the dignity of all human life. And I was astounded. And my supervisors were good people. I can't say they weren't. Board certified and doctors working there. But the culture of the place was that if you make too much noise, you can expect retaliation. So as the years unfolded, I started to understand what they were talking about. If you protested a little too loudly, you might find your tires slashed. You might find delays going to the clinic to a psych ward. Messages are delivered. A friend of mine was a physician's assistant. He refused in his write-up of a person's injuries to say that he'd slipped in the shower, instead put his frank impressions that he'd been beaten by the guards. He was told by the warden, no less, that his safety could no longer be guaranteed in that jail. Now that's right on New York City on Rikers Island, if you can imagine that. Now, I think that all of you have seen those horrific tapes of the beating death of Robert Brooks. I can't imagine who has not seen them. And if you haven't, you need to look up Marcy Corrections and watch. I always say it, I think every American needs to see what goes on inside our jails and prisons. And most notably, there were nurses who stood by and never did anything. Robert Brooks is very involved, Jr. is very involved with this legislation that we are working on. And he feels strongly that if it had been in place, his father would still be alive, because those nurses would have been required by law. And that's what this bill very much is about, to report it. It sets up safe reporting mechanisms, which is absolutely essential. When I worked at Rikers, I just lamented that there's no safe way for me to keep myself safe and the person that I am talking about, because there's retaliation against that person as well. So your hands are very tied, and you're working a tightrope between trying to do good work, to help people. All the while, every shriek you hear, you're just like, oh my God, please don't let this, be anybody who's let it not be as bad as it sounds. But we all would gather and talk, but we had no ability to do anything. You're walking a very fine line, and people can't believe it, but the culture inside jails and prisons is very different from the outside world, where your normal ethical behavior gets very inhibited if you want to survive, if you want to work there. And for one person to make noise means that you get sidelined, put in a rubber room, quit, get fired, you can't function there. So you're out, but nothing has changed. So this bill is about change. This bill is about, there's many components to it that I can't really get into right now, but safe reporting mechanisms to an inspector general, data collection, mandatory investigations. And this puts everyone on notice that things are different. You will be reported. There will be consequences, and we believe that this could change the culture inside jails and prisons. Healthcare professionals, social workers are a quiet but very critical presence inside most jails and prisons, and we have to be enabled to speak up, to protect people who are defenseless, as well as to act in accordance with the ethics of our professions. So we meet regularly. We meet once a week, a legislative committee, anyone 4 o'clock. Anyone is welcome to join us. You'll meet legislators. I've learned so much about the legislative process. And if this gets passed, it will be the first of its kind in the country. And I'm very proud that our organization is at the forefront of promoting this legislation. So thank you.
Thank you so much, Mary, and to Justina, who had to go present for her class and teach young minds. That was
Yes.
very insightful. And, we know the atrocities with Rikers Island continue. And, people really need to step up and start talking more about this issue. So thank you so much, Mary, for everything that you do on that end to keep social workers and healthcare professionals in general accountable for speaking up about what they see. So thank you everyone for being here tonight and being here for the long haul. We know that there was a lot of information discussed today. We will be following up tomorrow to ensure that everyone gets the resources provided in the chat, as well as by all of these organizations to join. Their initiatives is provided to everyone who registered tonight. Presenters, if you do have your presentation and would like to share that with the group, please send it to us and we will include that in the follow-up email as well as with the recording. So now we have about 5 minutes before we end this presentation tonight. Does anyone have any questions? We still have the Raise Children Coalition here. We got the New York Health Act. We got Social Workers Against Solitary Confinement. Are there any questions here for the group? Feel free to raise your hand or drop a question in the chat. Oh, and I see Gideon put our email is in the chat as well if you would like to get plugged into anyone. Oh, and thank you, Riza, who says this was really informative and helpful. Thank you. So yeah, I know it's a lot to digest and process, and so you will be getting all these resources in your email no later than tomorrow. So I'm also going to drop in the chat our advocacy page. We do feature the coalitions that we support on the advocacy page for people to get plugged in and to see more about what social workers should pay mind to and attention to. So thank you all for being here tonight, and we'll hold space for a couple more minutes in case there are any questions before we all give you your evening back to get some dinner. I'm going to go ahead and stop the recording so we can have a more open space as well.